And thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better decisions you can make. And knowledge is power. And today's topic is on TMJ disorders. And bringing this great information to us is Dr. Roy Hakala, a dentist, and he's located in the Midway area of St. Paul, Minnesota. Welcome, Dr. Hakala.
Thank you, Tina.
I'm so delighted that you could come back, and it was such a great previous presentation that you gave us, but I'm not sure a lot of my viewers got to meet you. So I would really like to go ahead and give you this time to kind of do a little bit of your background, your love, your passion, and why you went into this profession.
Certainly, Tina. Well, I had a general dental practice for many years, but something I discovered along the way is that orthodontic treatment was essential for the children in my practice since I was in a small town. And I began training in orthodontics, and as I got more deeply into it, I discovered that even a minor tooth movement can make a major difference in the way the jaw and the skull align, and can make a major difference either for the better or for the worse, depending on how it's done, to chronic pain problems, particularly headache, jaw pain, facial pain, and neck pain. So through the years, I worked more and more deeply into the field, and in 1994, I established the Minnesota Craniofacial Center Midway in St. Paul, which is dedicated to the treatment of TMJ disorders.
Okay, that's great. And you're here to educate my viewers, and I know a lot of people probably aren't really familiar with the terminology. So if you could explain in more detail for them, and of course in layman's terms, exactly what TMJ is then.
Certainly.
Okay.
Well, many people come to my office and ask me, do I have TMJ? Well, really, TMJ is just the name of the joint. Okay. So I have a plastic skull here, and if we look at where the TMJ or jaw joint is, it connects to the temporal bone of the skull, and the name for the jaw is mandible in medical technology. So TMJ stands for temporomandibular joint. Now, many things can be wrong with the TMJ, but if people simply ask me, do I have TMJ, I suppose the wise guy answer would be, well, certainly, you have two of them.
Right, because that is part of our anatomy.
Exactly. So then the concern is, what could possibly be wrong with the joint? And the whole group of TMJ disorders is abbreviated as TMD, temporomandibular disorder. There are several things that can be wrong with the TMJ, just as there are things that can be wrong with a shoulder, knee, or elbow. Okay,
wow. So how do you know if you actually have that disorder, the TMJ, or TMD, I guess I should refer to it?
Yes. Well, TMD is often called the mask disease or the great imposter, because it imitates so many other things. For example, the most common symptom of TMD is headache, including migraine headache. And people will often medicate themselves for migraine, or their physician will to help them get out of pain, but they never really discover that it's coming from a TMJ disorder. Other simple and straightforward signs of a TMJ disorder are facial pain. That is, people whose faces hurt, the cheek hurts, the jaw hurts. Also, difficulty opening or closing, difficulty opening wide enough to bite into a large sandwich or a submarine sandwich, irregularity on opening or closing, pain after eating, and ear problems are one of the 5 most common symptoms of a TMJ disorder.
Okay, so in a normal setting, someone chewing gum, you know, their jaw being used so much, that's normal. But whereas you're hearing some clicking, then you know that they should come in and maybe talk with you about the possibility of having TMD.
Right. Clicking, crunching, difficulty opening, or irregular opening. Those are all common signs.
And you mentioned also the ear.
Exactly.
So
again, if we look at the skull, the ear opening is right here, right behind the TMJ. In fact, the bone that separates the ear from the TMJ is only about as thick as your fingernail. There's also an opening going through it and ligaments that directly connect the TMJ to the bones of the ear. That's one reason that if you clench your teeth hard enough, you can sometimes dull sounds. Right. For example, if you expect the sound of a firecracker or fireworks going off. So ear problems of various kinds, including ear congestion, ear pain, suspicion of an ear infection, hissing, buzzing, ringing, things that we call tinnitus, are very common signs of a TMJ disorder also.
Okay, so the actual jaw bone itself, how is it that that causes the actual pain then?
In the healthy TMJ, the socket, of course, located right in front of the ear, fits with the condyle. That's the name of this bony knob that's really part of the lower jaw. But you don't want to have bone-on-bone contact anywhere in the body. So as in other joints, this joint has a disc. Now that's the loosest disc in the body. It's not firmly connected to either side of the joint. Instead, it's lubricated both top and bottom. It has to be because of the way the joint works. If you open a little bit as your jaw opens, that bony knob, that condyle, turns underneath the disc. If you open wider, the whole assembly slides, or if you chew from side to side, it follows. So that's in a healthy joint.
Right.
But the problem is that being the most unstable disc in the body can be displaced for various reasons. And when it goes out of place, it typically goes forward. And this is a very common TMJ disorder. It's called disc displacement because the disc is out of its normal place.
Right.
When the disc goes forward, the bone goes back and it presses into tender tissues that are back in this area. Typically, that's where the joint pain comes from. Now, joints don't exist entirely on their own. They're operated by muscles.
Okay.
And if the joint is displaced, the muscles respond by tightening up, almost as though they're trying to protect the joint. One large muscle is the masseter muscle that comes from here to here. That's the muscle you can feel if you clench your teeth and it bulges out sideways.
Okay.
That muscle can become very tender either at the cheekbone, in the center, or down where it connects to the jaw. Another muscle that gets involved is the temporalis muscle, large muscle over the side of the head, covers this whole area. You can feel that if you put your finger up here and clench hard. You can feel that muscle move a little bit too.
Right in the temple area.
Exactly. That muscle gathers itself up, goes under the cheekbone, right behind the eye, goes under the cheekbone, and connects to the jaw down here. When that muscle gets tight, people typically have a headache right in the temples. It can feel exactly like a migraine headache. And it even causes blurry vision because it is so close to the orbit of the eye and, in fact, behind the outer third of the eye.
Right. So it's even possible that someone may have been misdiagnosed in regards to a migraine.
Frequently.
Yes.
Migraine headaches are one of the very common symptoms of a TMJ disorder, and if that really is true, treatment of the TMJ disorder often either greatly reduces the frequency of migraine headaches or completely eliminates them. It's a field that's very rewarding to work in because pain relief is a very, well, fortunate thing for people to be able to obtain.
Oh, wow. And can you imagine having these migraines for so many years and then finally realizing with all the medication they were put under that it was something that TMJ or TMD that they could have had resolved.
Exactly.
Yeah, wow.
Exactly.
So this is actually, you were explaining, of course, a healthy environment, but I know the TMD, you hear a lot of clicking. So is that because it's out of place, or then it's getting bone on bone, or could you explain that a little more detail?
Certainly. And before we actually get into that, why don't we show a little video of exactly what a normal joint would look like.
Sure.
So as we go to this first video, this was done by Dr. Per Westison in Sweden years ago.
Okay.
They took anatomic samples, dissected them, and then operated them under a video camera. Here you can see the joint moving. You see the condyle in the center, and you can see the disc between the condyle and the socket. The disc is that bow tie shaped structure. And as the joint opens, first that condyle rotates under the disc, and then the condyle and the disc slide forward and back. So that's a healthy joint, and you can see that there's really no pressure on any of the tissues behind the disc. That's how it's supposed to work. Now, if we can come back to our plastic skull here for a moment, when people start to have clicking problems with the joint, frequently, in fact the most common click, is a result of the disc being out of place